So one of the most common questions patients ask me is general anesthesia safe? It's a fair concern, especially when you're choosing to have an elective surgery like a cosmetic procedure. Today, I'd like to talk through what general anesthesia actually involves, how we ensure it's safe, and why the UK in particular has some of the highest safety standards in the world. Hi, I'm Dr. Hish. I'm a consultant anesthetist and I work with Creo Clinic. So what is general anesthesia? So general anesthesia is a complete state of unconsciousness where there is no recollection and there is no movement during the surgical procedure. However, sedation. So sedation, you can have conscious sedation and you can have deep sedation. Conscious sedation is when you are slightly drowsy but alert and you are just relaxed. Whereas deep sedation, the same drugs used for general anesthetic are used for deep sedation, but lesser doses are given. So you are still, although you're sleepy, you are still easily rousable. With regards to local anesthesia, you're completely awake. There are no drugs given through the vein. However, a numbing agent is administered to the surgical field, be it small or large. So general anesthesia is different than local anesthesia or sedation. In plastic surgery at Creo Clinic, we often need to use general anesthesia. This is due to the procedure type, the length of the procedure, and obviously keeping the patient comfortable. And sometimes we need the muscles to be relaxed as well. So when do we use general anesthesia in plastic surgery? At Creo Clinic, we use general anesthesia for procedures that are longer, involve more tissue manipulation, or require absolute stillness for precision. This includes surgeries like abdominoplasties, high-definition liposuction, breast surgeries, and other body contouring procedures. So what is the process for general anesthesia? So here's what happens when you come in for general anesthetic on the day of your procedure. So pre-op, before the operation, we always start with a full health check. We look at your medical history, current medication, allergies, along with lifestyle factors like smoking, recreational drug use. The goal here is to flag anything that could increase risk. For example, breathing problems, heart conditions, reactions to certain medicines. This way, we can plan your anesthetic in the safest way possible. Following that, we have induction. So when it's time to begin, we administer the anesthetic drugs via an IV line. So at Creo Clinic, we follow the Apex recovery protocol. So this means we use the safest combination of medication that are personalized for each patient. And we do it all without using any long-acting drugs. Instead, we use a careful combination, short-acting medication, which all lead to a faster wake-up, less nausea post-operatively, shorter hospital stay, and a smoother recovery after surgery. So the next step is maintenance. During the procedure, we carefully monitor many things. That includes your heart rate, your heart rhythm, your blood pressure, your oxygen levels, your carbon dioxide levels, the ventilator itself, how much is delivered to you, how frequently, airway pressures, and the list can go on. And we adjust the medications carefully throughout the procedure to keep you stable, comfortable, and safe. So the final step is recovery. At the end of the surgery, we gradually reduce the anesthetic so you can smoothly wake up in no pain. So with the Apex protocol, most patients are fully awake and responsive within 15 to 30 minutes. And of course, will be continued to be monitored closely as they recover. Thanks to the Apex recovery protocol we developed, patients are typically back on their feeling clear-headed more quickly. So you can get back on track sooner after a procedure. So how safe is general anesthesia? So modern anesthesia is incredibly safe, especially here in the UK. So the most common side effects are mild. Things like a sore throat from the breathing tube, nausea, or just feeling cold. These are temporary and very manageable. Serious complications are very rare, especially when anesthesia is administered by a trained specialist and you're monitored throughout. And that is why who looks after you so closely is so important. So what makes anesthesia in the UK so safe? So one of the key reasons anesthesia is so safe in the UK are the standards we adhere to with regards to staffing. By law, any patient that is under general anesthesia must be cared for by 2 clinicians at all times. So here at Creo Clinic, that would include a consultant anesthetist like myself and an operating department practitioner, or also known as an ODP, who assists me. This means you are never left alone. There's no multitasking, no room hopping, no cutting corners. It's just one patient, 2 professionals for the entire procedure, just to monitor the anesthetic part. In other parts of the world, a single anesthetist may have to monitor multiple patients at the same time, while assistants handle most of the one-on-one monitoring. In less developed countries, it's not uncommon for a patient to be maintained with automatic machines with an anesthetist checking in every now and again. That is absolutely not how we do things here in the UK. We stay with you from start to finish. This level of close monitoring and precision is one of the reasons why our Apex recovery protocol works so well. It starts with anesthesia that is carefully tailored and expertly delivered, so patients wake up faster, feel better, and recover more comfortably. So how does this impact the cost of surgery? Of course, these high standards always come with higher costs. When you have 2 highly trained professionals dedicated to your care. That means more staffing, more training, and stricter protocols. But it also means higher standards of safety, faster response time if anything changes, and more peace of mind for you as a patient. Here's what you can expect at Creo Clinic. At Creo Clinic, we follow all UK national safety guidelines and more. Before your surgery, you will speak with me or any of my colleague consultant anesthetists. We'll review your medical history, answer your questions, and tailor your anesthetic plan as much as you need. During your operation, we'll be at your side all the time, supported with a trained ODP. And after your surgery, we monitor you in recovery very closely until you're awake, stable, and ready to go. Following that, you will get clear instructions on what to expect the following days and the hours and days that follow. So I hear a lot of myths about anesthesia, so let's debunk a few. Number 1, what if I don't wake up? Modern anesthetics are carefully monitored and measured. You will wake up safely and smoothly. Second, does anesthesia damage the brain? There is no evidence that anesthesia causes long-term brain damage in healthy individuals. Number 3, is it riskier because my surgery is cosmetic? Absolutely not. The fact that it's an elective surgery actually gives us more control. We can plan thoroughly, optimize your health in advance, and proceed only when it's safe to do so. General anesthesia has come a long way. You're in a system built around your safety. We don't cut corners, we don't multitask, we stay with you, always monitored, and make sure you wake up feeling safe, supported, and ready for your recovery. If you have any questions, bring them to your consultation. Always happy to talk it through.